Assalamu alaikum wa rahmatullahi wa barakatuh. Hi guys, and I really hope you guys are doing well. So today is Wednesday. It's around 8:38 Hapo p.m. and I sorry for the day. So while I was coming to the end of like my nearly 30-hour shift today we met one of the senior nurses, and we were like it was me and another intern. So we were just like complaining of how hard everything is, the hours that we work. And mind you, like in this particular case, I hadn't eaten for like more than 24 hours at that point. Like the last meal I had was yesterday morning, and it was around 11-ish in the morning. So those past 24 hours. Anyways, we were complaining, and she mentioned a few things that were really, really, I would say, moving and were really impactful in that sense. So, one, she told us of the obvious: eat, as an intern, just excuse yourself. Sometimes there's a lot to be done, and people actually faint, people actually, I don't know, lose themselves, just you do the most basic thing you can do sometimes to take care of yourself is just eat, and a good way, like I personally I see is practical, is to tie that up, if you're a Muslim, with your praying times. As you go to pray, like you excuse yourself to go and pray, do like excuse yourself for like 30 minutes, use the other 15 minutes to go and probably eat something or look for something to eat, and just use like 5 minutes to eat on that break that you're going to pray. And preferably before Salah as well. So the other thing, okay, that's like she told us to like eat and always like carry snacks on our bags. Don't just carry vacuumators and gloves and I don't know patients files and whatever we carry on the bags, but just carry little snacks to carry along. It goes a long way because it really helps you fill in the gaps. So that's one. Two, she told us about like, yes, the hours are like a lot. And trust me, my opinion is that even if the training has to be this tough, it doesn't have to be that way. But we'll have that conversation for another day. Like working 30-hour shifts, really? Is that the way to do medicine? Anyways, let's keep that conversation for another day, guys. So, luckily, she told us that it's hard. Yes, it's really hard. And sometimes this is the way we have to go. But for you to see that consultant, for someone to make that decision in a ward round, for instance, to add this particular medication or remove this from the treatment or do this, do that for this patient, or like, you know, like the decisions and like the title itself, being a consultant, being a senior, I will say senior nurse, senior resident, being a senior MO, being whatever senior, it comes with a price. And the price some of the times is not like, I don't know, having to go to school a lot, maybe read a lot, do a lot of exams. No, sometimes the prize is actually us, the groundwork. The groundwork is really, really hard, guys, like staying long hours, for instance. I would say like a very practical example and a very interesting way to put this into perspective would be, if you see a very skilled surgeon, for instance, you see someone, for instance, who can do a certain procedure in very few minutes, for instance, or like with a very fine technique, or like a very fine way of doing things and being confident, like very eloquent. Eloquent isn't the word to use in this case, but like something very efficient, I would say, very perfect. For that person to reach that point, even if they were a skilled person with their hands, they're very good with their hands. Whew, but holding the instruments, doing whatever they have to do, the technique, whatever the skill, they must have put in a lot of hours. Like wamebeba experience kwa mgongo. So that means there is a point in time where for this person to get where they are right now, they did suffer. And I really think that's important. Like, we need to have more of these conversations, especially with the young clinicians, with the young MOs, with the young, I don't know, nurses, with the young people who are entering the profession, the medical profession, at a very young age. and anyone like the new students, the new interns, like it's something that needs to be talked about and something that needs to be normalized, that despite us going through a lot, despite us going through a lot of things in the name, like a lot of erratic hours in the name of experience, like it is the price sometimes that we pay. I don't necessarily propagate or like defend or like raise a flag to say that this is the way it has to be. No, no, I actually have my own opinions on that, but I'm saying like it a fika point where there has to be a price that needs to be paid, and sometimes in our system, considering what we have in Kenya, what we have in Africa, sometimes the price is actually that, working 30-hour shifts, going, struggling, suffering, and all that. I remind you guys, I'm not propagating that. I believe that there are better ways to do internship, there are better ways to actually learn, there are better ways to gain the experience, but sometimes that's all we are served with, and we have to do it. So that's enough of a rant. Yeah, but I thought that whatever I was told was impactful, and I think that you guys will benefit from it as well. So yeah, I'll come and give you guys an update on how internship is going so far. But you guys, yeah, 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 yeah. Someone never told you, never told you. Hey, internship is not a joke, man. Hey, you guys. Hey, no, unbelievably, unbelievable, unbelievable. That's all I can say at this point. Anyways, also, have you guys seen this acharis? Has anyone tried this? I was like at the shop today, and then I saw these ones. I was like, what are these? And they told me they are acharis. So